Hello, this is Matthew O'Donohue Walcott. Today's topic is going to be COVID-19 defined and its impact on social inequality. So, starting off, Scientific American was founded in 1845 and amassed a massive following of over 10 million people. Though they do not publish their own research, they do publish and present research that has already been peer reviewed in scientific literature. Within this article, the authors are trying to properly inform the public about the COVID-19 virus. The main concern for many people is how the virus is so contagious and which ways are scientists trying to stop this virus. Let us dive deeper into how this virus is easily passable. Now here's a picture of the COVID-19 diagram. As you can see in the orange, those are going to be the S proteins. The S protein forms spikes which enable it to grab onto human cells that are hundreds of times larger than itself for the particle to move inside the cell. The RNA is going to be these red squiggly lines, as you can see here. The RNA is going to be the genetic code for the virus, and once it has access to the inner parts of the cell, it can begin replication. This replication can include creating duplicate RNAs, viral spike proteins, and new particles which can exit the lung cell to be passed on to others. The immune system is also working during this time, but there are several tactics that slow down the body's natural immune response. One example is the spike protein covering themselves in sugar molecules called glycan, and this is going to be used to block incoming antibodies from attaching to the virus. A few ways that scientists are creating vaccines are by creating modified versions of the virus, by injecting COVID-19 antigens into people's immune systems. These antigens present a small portion of the virus to helper T cells, which help B cells turn on and create antibodies for the actual virus. Helper T cells will also communicate with killer T cells to find ways to destroy affected cells within the lungs. What makes COVID-19 so difficult to combat is that the SARS-CoV-2 RNA code is incredibly large. As you can see in this diagram, it has a list of a few different viruses that we've had in the past. Rhinovirus is going to be also known as the common cold. As you can see, it has about 8,000 bases long in its RNA code, compared to the SARS-CoV-2 virus being almost 30,000 bases long. Now this allows for a multitude of different strains which could normally cripple the virus, but because COVID-19 is able to correct mutations within its RNA code, this allows it to continually replicate even though it will have mutations. Now the Journal of Racial and Ethnic Health and Disparities is a new journal that was founded in 2014, which publishes original research and reviews. They seek to recognize and eliminate health disparities that are based on race and ethnicity. For this article, the researchers performed an ecological study between infection and mortality rate of COVID-19, accounting for variables such as demographic, socioeconomic status, and mobility in 369 counties for a total of 102,178,117 people. The states examined were some of the most affected, which included Michigan, New York, New Jersey, Pennsylvania, California, Louisiana, and Massachusetts. The data sources in this study include publicly available data from USA Facts and the U.S. Census Bureau for COVID-19 cases and county-level demographic data. COVID-19 data reported by each state on the Department of Health websites, state population by race and ethnicity data, and mobility data extracted from Google. The outcome variables include the rate of COVID-19 infection and all COVID-19 related death as provided by each state's Department of Health as of April 9, 2020. The infection rate is based on the reported results from all the laboratories testing samples in each county and state. The mortality data are reported by hospitals, nursing homes, and other health facilities. Researchers found that counties with a higher total population, education, income level, and more diverse demographics were at more risk for COVID-19 infection, but at a lower risk of mortality. Counties with a smaller population, higher disability rates, and higher poverty levels have a higher rate of mortality. This study's findings are also in line with the recent analysis of over 3,000 U.S. counties. The reasoning for high mortality rates can be due to limited access to higher quality healthcare in rural areas, lack of mobility, and higher rate of comorbidities. Counties with higher percentage of people on Medicaid had a strong association with increased poverty levels, as well as a higher death rates due to COVID-19. Lastly, data from each state show that African Americans might be disproportionately affected by the pandemic. 1,981 African Americans infected cases per million, compared to 658 Caucasian cases per million. Scientific American and Journal of Racial Ethnic Health Disparities are both great resources of information, but both have their own niche. Scientific American brings forward new scientific information to the public in a palatable way. This is a great, especially on topics such as COVID-19, where there is so much misinformation being distributed on the subject. The Journal of Racial and Ethnic Health Disparities attempts to find how this data can highlight the effect of COVID-19 has had on certain demographics, but also what underlying factors led to a higher infection or mortality rates within these communities.